I'm Dr. Wilson from Hands on Health in Montesano. So last night we had a mama write on our Facebook wall telling us that after her adjustment yesterday, her baby finally dropped. That's awesome. And I thought it would be really fun to make a little video and explain to you the connection between chiropractic care and having your baby drop. So this mama is 39 weeks pregnant and she's been seen periodically throughout her pregnancy. I have a model here of a pelvis to show you that there are 3 joints in the pelvis. There's 2 posterior joints called the SI joints, and there's one in the front at the pubic symphysis called the pubic joint. All 3 of these joints regularly need checked during pregnancy. Because of the relaxin that is designed to separate these joints during birth, they can also become unstable or very easy to shift during pregnancy. And what we don't want about that, I will show you with a few rubber bands. Hopefully these show up. Oops, I'm kind of tying knots in my rubber band. Okay. So this is my kind of demonstration of the pubic joint in the front, and then back here where it's wider, this would be the SI joints. So this would be the pelvic bowl that creates the pelvic outlet down here where the butt of my hands are. And in a nice aligned pelvis, so aligned meaning where the joints on one side are straight to the joints on the other side, this would be the perfect shape or the most natural position for our pelvis to be in. And when we have misalignments in our joints, it shifts. So from a side view, we can see that it actually pulls on structures. It pulls on ligaments and tendons and muscles. And from a top view, so this is where baby sees, it actually makes the size of the pelvic outlet distorted. So what then that can cause during pregnancy depends really on where you are at in your pregnancy. Early on in the pregnancy, how that can affect it is that as the uterus grows up and outwards in the pelvic bowl, there are what is called uterine pelvic ligaments that attach actually from the uterus itself down to the bony part of the pelvis. So if the pelvis is then torqued, it pulls on unevenly from side to side the actual uterus itself. So the front of the uterus on one side can be pulled more tightly, and the back of the uterus on the other side is common to be pulled more tightly. This can cause different things, either the feeling of sciatica during pregnancy, if you've heard of round ligament pains, if you've experienced them and your doctor said that you're experiencing round ligament pains, this can be a culprit of that, or just general aches, pains, or discomfort. So in order to be the most comfortable through pregnancy, we advise starting chiropractic care early on. Throughout pregnancy, we want baby to grow and position, eventually to go head down. If there's not enough room in the lower portion of the pelvic bowl, then it's very common for baby not to flip or turn, or for a breech presentation. Breech presentation is one of the highest incidences of an unwanted cesarean section. So chiropractic care many times can help us avoid that. If we are at the end of pregnancy, like our mama who wrote on our Facebook wall today was, what we're looking for is baby's head to drop deeper into the pelvic bowl, to rest upon the cervix, and then to start initiating the hormonal reaction that sends mama into labor. If the pelvis is distorted, how we showed you, if it's misaligned and it changes the shape of the pelvic outlet, baby's head can't all the time engage. This can then lead to stalled labor, or if hormonally labor has actively began, it can lead to failure to progress. So we've heard of that phrase in the birthing world a lot, failure to progress. And a lot of times, again, that leads to an unwanted C-section. So those are all reasons that we want to stay nice and aligned during pregnancy. And in this mama's case, who is today, baby has dropped, and hopefully soon she'll be going into labor, this seemed to have been a trigger for her for her. When she came in, she was quite distorted in her pelvis, more so than typical for her. We adjusted her and baby was able to drop. So that's really exciting news, and hopefully that helps somebody out there who's watching this video to make more sense of the connection between chiropractic care and initiating labor.